What is the mortality rate for children infected with measles? A. 1 in 20. B. 1 in 2000. C. 1 in 50. D. 1 in 10,000. E. 1 in 500. The answer is E. 1 in 500. Measles, while generally only a moderately severe disease, is fatal in 1 out of every 500 children who contract the virus. Genital herpes is caused by what virus? A. Herpes simplex virus type 1. B. Herpes simplex virus type 2. C. Herpes simplex virus type 1 and 2. D. Human herpes virus 7. The answer is C. Herpes simplex virus type 1 and 2. Genital herpes is most frequently associated with herpes simplex virus 2, HSV2, while herpes simplex virus 1, HSV1, has been associated more often with oral herpes, cold sores. However, new evidence suggests that both viruses can live in either location. HSV1 can spread to the genitals and cause genital herpes, while HSV2 can be spread to the oral mucosa to cause cold sores. Adult complications from cytomegalovirus, CMV, are most common in what population? A. Teens. B. The elderly. C. Athletes. D. Immunocompromised individuals. The answer is D. Immunocompromised individuals. In adult populations, cytomegalovirus poses the greatest risk to immunocompromised individuals, such as people on immunosuppressive drugs or in HIV patients who have developed AIDS. In pregnant people, CMV generally does not pose a risk to the mother, but rather to the fetus. Athletes and teens that are not immunocompromised often will have mild or unnoticeable symptoms when infected with CMV. What type of virus is molluscum contagiosum? A. Retrovirus. B. Adenovirus. C. Poxvirus. D. Herpesvirus. The answer is C. Poxvirus. Molluscum contagiosum is a form of poxvirus. Poxviruses are a family of enveloped group 1 double-stranded DNA viruses that includes molluscum contagiosum virus, smallpox virus, vaccinia virus, and monkeypox. Which of the following class of viruses is responsible for all warts, including plantar warts, genital warts, flat warts, and common warts? A. Epstein-Barr virus. B. Herpes simplex. C. cytomegalovirus. D. Human papillomavirus. The answer is D. Human papillomavirus. All forms of warts are caused by the virus HPV, or human papillomavirus. In addition, HPV is the cause of a variety of dysplasias, including cervical dysplasia, vulvar dysplasia, and oropharyngeal cancer. None of the other viruses listed are associated with warts of any kind. Over 70% of cervical cancers are associated with which two strains of human papillomavirus, HPV? A. 6 and 11. B. 16 and 18. C. 31 and 33. D. 2 and 7. The answer is B. 16 and 18. While HPV strains 31 and 33 have been associated with genital malignancies, more than 70% of cervical dysplasia is associated with HPV strains 16 and 18. Strains 6 and 11 are associated with genital warts, while 2 and 7 are associated with common warts. %90 of cases of Condylomata acuminata, genital warts, are caused by what two strains of human papillomavirus, HPV? A. 6 and 11. B. 51 and 52. C. 42 and 43. D. 30 and 54. The answer is A. 6 and 11. While all of the strains of HPV may cause Condylomata acuminata, 90% of all cases of genital warts are caused by just two strains, 6 and 11. All of the following are forms of herpes virus except A. Varicella zoster. B. Herpes simplex. C. Epstein-Barr virus. D. Rotavirus. The answer is D. Rotavirus. There are more than 130 types of herpes viruses. Of those, 8 are known to infect humans. Some of the more common examples are herpes simplex 1 and 2, varicella, zoster, Epstein-Barr virus, and cytomegalovirus. Less common viruses include human herpes virus 6, human herpes virus 7, and Kaposi's sarcoma-associated herpes virus. Rotavirus is not a herpes virus, rather, it is a double-stranded RNA virus in the Reoviridae family. Human papillomavirus, HPV, is associated with increased risk of which of the following cancers? A. Oropharyngeal cancer. B. Anal cancer. C. Vulvar cancer. D. All of these are correct. The answer is D. All of these are correct. Human papillomavirus has been associated with several forms of cancer, including cancers of the cervix, vulva, anus, and oropharynx. It is also associated with penile and vaginal dysplasias. Which of the following is the microbe most frequently associated with the common cold? A. Influenza. B. Human coronavirus. C. Rhinovirus. D. Adenovirus. The answer is C. Rhinovirus. Rhinovirus, a type of picornavirus, is implicated in up to 50 to 80% of cases of the common cold. Other less common causes include human coronavirus, 15% of cases, influenza, 10%, and adenovirus, 5%. Which of the following microbes is the most common cause of infectious vomiting and diarrhea in infants and small children? A. E. coli bacteria. B. Giardia parasite. C. norovirus. D. rotavirus. The answer is D. rotavirus. The majority of infectious vomiting and diarrhea in infants and young children is viral in origin, with the most commonly implicated virus being rotavirus. Norovirus is another common cause of viral gastroenteritis in individuals of all ages, though it is not as common in young children as rotavirus. Zika virus is primarily dangerous to which of the following populations? A. Young children. B. Unborn fetuses. C. Pregnant women. D. The elderly. The answer is B. Unborn fetuses. In most children and adults, Zika virus causes a mild fever characterized by myalgia, fatigue, and headache. The population most at risk for serious complications from the disease is unborn fetuses. Exposure to Zika virus before birth has been associated with microcephaly, a frequently fatal disorder of abnormal skull and brain development. Which of the following are structurally similar to the influenza virus? A. Togaviridae. B. Retroviridae. C. Coronaviridae. D. Rhabdoviridae. E. Paramyxoviruses. The answer is E. Paramyxoviruses. Each of these viral families or groups has an RNA genome and envelope. The paramyxoviruses are structurally the most closely related to influenza, since both are negative sense RNA viruses and many of the paramyxoviruses contain neuraminidase and hemagglutinin. The viruses in the Togaviridae and Coronaviridae families differ from the influenza viruses in that they have a positive sense RNA genome. Viruses in the Rhabdoviridae family, which includes the vesicular stomatitis virus and the rabies virus, are bacilliform negative stranded RNA viruses. Paramyxoviruses possess hemagglutinin and neuraminidase that are present on the A. Golgi bodies. B. Endoplasmic reticulum. C. Nucleus. D. Same spike. E. Different spikes. The answer is D. Same spike. Paramyxoviruses possess hemagglutinin and neuraminidase that are present on the same spike. This is in contrast to the orthomyxoviruses that possess hemagglutinin and neuraminidase on different spikes. These enveloped, pleomorphic, and ssRNA viruses cause respiratory infections by droplet nuclei or contact transmission. These belong to the orthomyxovirus group and are called what? A. Respiratory syncytial virus. B. Influenza virus. C. Lentiviruses. D. Parainfluenza virus. The answer is B. Influenza virus. The influenza virus is a member of the orthomyxovirus group and is an enveloped ssRNA virus. Lentiviruses are a group of retroviruses which include HIV-1, parainfluenza virus and respiratory syncytial virus, RSV, belong to the paramyxovirus group. Which of the following is the most common cause of hand, foot, and mouth disease? A. Herpes simplex virus. B. Lassa fever. C. Parainfluenza virus. D. Rotavirus. E. Coxsackie virus. A. The answer is E. Coxsackie virus. A. Hand, foot, and mouth disease is a vesicular exanthem caused by Coxsackie virus A16. It is characterized by ulcerating vesicles on hand, foot, mouth, and tongue along with mild fever. The disease subsides in a few days on its own. Adenoviruses are transmitted by A. Aerosol droplet. B. Fecal oral. C. Mosquito bite. D. Tick bite. E. Direct inoculation of conjunctive bitonometers or fingers. The answer is A. Aerosol droplet. Adenoviruses are transmitted by aerosol droplets. They are not transmitted by fecal, oral route, direct inoculation of conjunctiva bitonometers or fingers, or tick or mosquito bite. Rubella virus is a member of the family of A. Adenovirus. B. Herpes virus. C. Picornavirus. D. Neisseria. E. Toga virus. The answer is E. Toga virus. Rubella virus is a member of the Toga virus family and not the herpes virus, Neisseria, family of bacteria, adenovirus, and picornavirus. Which of the following clinical conditions is associated with the Coxsackie virus type B? A. Gingivostomatitis. B. Herpangina. C. Bornholm disease. D. Hepatocellular carcinoma. The answer is C. Bornholm disease. Coxsackie virus type B is associated with Bornholm disease seen mainly in older children and young adults. Bornholm disease or epidemic pleurodenia or epidemic myalgia is a disease caused by the Coxsackie B virus. It is characterized by myositis causing paroxysms of stabbing pain in the chest muscles and abdomen muscles. Coxsackie virus type A and Coxsackie virus type B are members of the Picornaviridae family. Picornaviruses are naked viruses with an icosahedral nucleocapsid. The genome consists of single molecule of single-stranded RNA. Coxsackie virus type A is associated with herpangina, which is commonly seen in children. Herpangina is a severe febrile pharyngitis characterized by vesicles or nodules primarily on the soft palate. Subacute sclerosing painencephalitis is a late neurological sequelae of infection from what virus? A. Parvovirus B19. B. Arthreovirus. C. Papillomavirus. D. Measles virus. E. Hepatitis B virus. The answer is D. Measles virus. Subacute sclerosing painencephalitis, SSPE, is a serious, late, and rare neurological complication occurring 10 years after recovery from measles. This fatal disease is characterized by a very slow replication and spread of measles virus in the brain. Patients with SSPE do not show a high number of measles viruses in the brain, but they demonstrate unusually high levels of measles antibody in the blood and cerebrospinal fluid. Many years after recovering from measles, patients develop changes in personality, behavior, and memory. Those symptoms are followed by myoclonic jerks, blindness, and spasticity. Infectious mononucleosis can be caused by what? A. Cytomegalovirus. B. Adenovirus. C. Rickettsia. D. Epstein-Barr virus. E. Herpes virus. The Epstein-Barr virus causes infectious mononucleosis associated with the Burkitt's lymphoma in East African children. The virus is found in human oropharynx and B lymphocytes. It is transmitted primarily by saliva. The infection begins in the pharyngeal epithelium, spreads to the cervical lymph nodes, then travels through the blood to the liver and spleen. Epstein-Barr virus belongs to the family Herpesviridae and is the causative agent of infectious mononucleosis, Burkitt's lymphoma, and undifferentiated nasopharyngeal carcinoma. Infectious mononucleosis characteristically produces a marked lymphocytosis involving almost all of the lymphoarticular tissues. This leads to hepatomegaly, splenomegaly, lymphadenopathy, and lymphoid hyperplasia of the oronasopharynx. The peripheral blood smear contains atypical lymphocytes of the Downey 2 type. It is generally a self-limiting disease, however, it can cause a severe protracted illness that can at times prove to be fatal. Patients with an unusual immunodefect known as the X-linked lymphoproliferative syndrome frequently have overwhelming EBV primary infections, which can be fatal in the majority of the cases. Which of the following viruses consists of circular DNA that is partially double-stranded and partially single-stranded? A. Respiratory syncytial virus. B. Epstein-Barr virus. C. Hepatitis B virus. D. Varicella zoster virus. E. Lassa fever virus. The answer is C. Hepatitis B virus. Hepatitis B virus is the DNA virus that is part of the Hepatnoviridae family. The characteristic feature of the virus from this family is that the genome consists of a circular DNA that is part double-stranded and part single-stranded. The virions are spherical particles with an envelope. Hepatitis B virus consists of icosahedral core within a closely adherent capsid that contains cellular lipid, glycoproteins, and a virus-specific surface antigen called hepatitis B surface antigen, HBsAg. Respiratory syncytial virus is RNA virus that has linear single-stranded non-segmented RNA. Lassa fever virus has a circular single-stranded RNA in 2 segments. Varicella-Zoster virus and Epstein-Barr virus consist of a linear double-stranded DNA. Which one of the following is an example of a chronic carrier infection? A. Toga virus. B. Hepatitis B. C. Neonatal rubella virus. D. Retrovirus. E. Cytomegalovirus. The answer is B. Hepatitis B. Hepatitis B is an example of a chronic carrier infection where a carrier state can follow an asymptomatic infection, as well as actual disease. Neonatal rubella virus, cytomegalovirus, retrovirus, and Toga virus do not cause chronic carrier infection. HBsAg may remain detectable for life in many patients. Individuals who have positive findings for HBsAg are termed carriers of HBV. They may be inactive carriers or they may have chronic hepatitis. Anti-HBC is present in all patients with chronic HBV infections. The AG and HBV DNA may or may not be present. They reflect a state of active viral replication. HBV DNA levels are typically low or absent in inactive carriers. HBV DNA levels are higher in patients with chronic hepatitis B. High HBV DNA levels are associated with increased infectivity. Which of the following is a major cause of serious diarrhea in young children? A. Arenavirus. B. Parainfluenza. C. Human rotavirus. D. Herpes simplex virus. E. Coxsackie virus A. The answer is C. Human rotavirus. Rotaviruses can survive the acidic environment in stomach. The virus infects the small intestine and damages the epithelial cell lining the villi. The virus causes permeability changes and cell lysis, leading to malabsorption with water and electrolyte imbalance. Rotaviruses are a major cause of diarrhea in young children and are associated with outbreaks in preschool and daycare centers. Rotaviruses cause extensive tissue damage, leading to serious fluid and electrolyte loss. A 20-year-old pregnant woman presents at 21 weeks gestation with symptoms and signs of preeclampsia. Her symptoms have been present for the past 2 days. Prior to that, she had flu-like symptoms and a lace-like rash on her trunk and extremities and a flushed face. Intrauterine fetal demise was detected by ultrasonogram. Labor was induced, and a stillborn male fetus was delivered. Serum was collected for viral titers of the suspected agent that had caused the patient's flu-like symptoms and fetal demise. The viral IgM titers were positive, as suspected. What is the most likely offending agent? A. Parvovirus B19. B. Herpes simplex type 2. C. Herpes simplex type 1. D. Cytomegalovirus. E. Epstein-Barr virus. The answer is A. Parvovirus B19. Parvovirus B19 is a member of the family Parvoviridae and is the causative agent of erythema infectiosum, fifth disease. The hallmark symptom of erythema infectiosum is a mild rubella-like erythematous rash that produces arthropathy, especially in women. The disease has two separate components. The first component is the lytic phase, where the lytic action of the virus replication in erythroid precursors gives rise to a transient arrest of erythrocytic production. This can result in a slight drop in hemoglobin. Hemoglobin levels will substantially drop in those patients with chronic hemolytic anemia. This is the viremic stage, and mild flu-like symptoms with pyrexia and chills are not uncommon. These flu-like symptoms can last for 1 to 3 days. 1 week after the viremia peak, the second phase occurs, where the virus is rarely detectable. The second phase is where the erythematous maculopapular rash and arthropathy occur. The characteristic rash produces a lace-like appearance on the trunk and extremities and a slapped cheek appearance on the face. Erythema infectiosum infections in pregnant women can induce fetal loss, 5 to 20%, especially if the infection occurs at less than 20 weeks.